Septic shock is the next type of shock on our radar that I'll be talking about the possible management of septic shock. So to manage septic shock, septic shock is more of like there's some microorganisms. So microorganisms like mostly bacterial infections. So they went into your blood, okay? That's your circulatory system. So as they went into your circulatory system now, you know the blood actually goes to every corners of the body. So now your whole body is now what? Reacting to this condition. So let's define sepsis. We said that sepsis occurs when chemicals release into the bloodstream to fight an infection. These chemicals will rather trigger an inflammatory response throughout the body. Okay, so you could see that what inflammatory responses throughout the body can damage vital organs. So we are not talking about the management. We're not here to talk about the signs and symptoms and everything. We're just here to talk about the management. So for the management, you might want to do some laboratory tests like what? White blood cell count. Now you're trying to see what? If the amount of white blood cells are elevated. Now, if amount of white blood cells are elevated, you just simply suspect that there's an infection that these white blood cells are trying to fight. That's why there are so many, okay? You do a culture of the blood. If you're doing a culture of the blood, you want to identify the microorganism, okay? They do all those urine tests, that's urinalysis and all the stuff. The imaging, you might want to do some imaging to find out if there's any organ damage as a result of the sepsis. Then source control, if you have found out and everything, found out what is causing it, they try to control the source because it is the source that is causing the problem. So if you are able to control the source, the whole body will return back to its normal activities. Then you can also give intravenous broad spectrum antibiotics in large doses. So you give these broad spectrum antibiotics. Why? That's usually in cases where you don't actually know the bacteria causing the problem. So instead of giving a narrow spectrum type of antibiotics, which is targeted at a specific type of bacteria, you give a broad spectrum, which will just basically fight any bacteria in the system, right? Then you can, if there's formation of abscess, you can incise and drain, okay? Either using linear incision or cruciate incision, okay, to drain the abscess. Because most of the time, this sepsis will usually result in abscess formation in some parts of the body. You can also do the surgery. You can do a surgery to control the source of an ongoing contamination, okay, and this will follow what? Initial resuscitation. So I think that's it for what? Management of septic shock. All right, so see you guys pretty soon.